again, we're going to look at some of these trigger points that will set off the migraines, and one of them that is often present are the suboccipital muscles. Now I'd like to give you a case report of one of the patients that I treated in this way. She's a 15-year-old female, plays basketball on the high school varsity team, and does many other activities in spite of her chronic headache. She has tried all other therapies, including Botox injections, all types of medications, all types of various procedures that the neurologists tried without any significant success. Her headaches had initially begun relatively mildly about 3 to 4 years ago, and within a year or two became much more severe, and for the last 4 months she has had a constant headache that has not resolved at any time. She is presently on 3 medications, and they were ready to add another anti-seizure medicine to her regimen, and her mother was quite opposed to all these medications in a 15-year-old who is still going through her changes in various hormones, and her mother was quite concerned about adding these extra medications. When I examined her, she had trigger points in the neck, which I inactivated, and her headache was reduced by about 30%. Then I treated the sphenopalatine ganglion on the left. That dropped her headache, migraine type headaches, by about 70%. And when I did the right side, the headache resolved completely. And when she returned for her second visit, she indicated that had lasted for 2 to 3 hours. After 7 treatments, her migraines are gone now for 2 to 3 weeks at a time, returning only when her trigger points get activated when she is intensively studying. She's a straight-A student in addition to all of her other activities, and does a lot of intensive studying with leaning her head forward over her book, and hopefully she will begin to change those activities, and I've gotten her to raise the book so she doesn't bend over so much. I can't do much about the weather, but when it's cold or rainy or snowing, she gets significant flare-ups. Most recently, almost all of her pain was related to the trigger points. Her migraine pain is only about 30% of the intensity that it was when we began treatment. When it does come on, and she is off all medications at this time, not only hasn't had to take this new medication, but she's off of the other 3 medications, which were slowly tapered, and she stopped them. Now, before we get to any questions, I'd just like to briefly show you some of the references. The Travell and Simon's book is absolutely necessary for people to have if they're going to treat myofascial pain. And there are 2 articles that I've written, one on how my practice had changed back in 2006, and most recently I wrote an article that was published in Fibromyalgia Aware, where we use laser therapy to treat myofascial pain in fibromyalgia patients, mainly because it doesn't cause pain. And these patients are very sensitive to any kind of pain, and inactivating the trigger points with the ML830 changes their whole therapeutic response. So now what I'd like to do is get to any questions that you might have. Write them in the chat box if you have them, and I will try to answer some. We have a number of questions that have come in which I can answer. One that is commonly asked about at almost every webinar is what insurance companies will pay for the laser treatment and how to deal with it. Unfortunately, many of the insurance companies, as they always do with any new technology, try to avoid paying for these treatments as long as possible. Once there are enough people using the low power laser, they will have a hard time continue to refuse to pay for them. In our area, there are 4 companies that pay for this. Aetna, Cigna, United Healthcare, and most recently Care First gave up and started to pay for it. They each tend to pay for it as if it is a type of physical therapy or occupational therapy. Aetna seems to pay the most. They obviously don't read the paperwork which I submit with every billing statement, which includes a statement that this is not physical therapy and it's done by me personally, and indicates the various specifics of how the laser was used and which laser was in fact used. So I think it will be fairly soon that most of the insurance companies will be at least beginning to pay for some of this, and hopefully they will begin to pay for it in full when they recognize that it actually saves huge amounts of money and prevents patients from having to go to surgery, which even though they like patients to go to surgery since they can use that as a reason to raise premiums, they would more like, I think, be able to save money overall when they begin to be convinced of this. There was a recent article published in the Lancet in December which should unquestionably prevent any of the insurance companies from continuing to say that this is not safe and effective, and demonstrably by papers that have been, or a paper that's been published in a very respected peer-reviewed journal, where a paper was submitted and published that came out of Australia, where they did a meta-analysis of all of the literature which has been published on the use of the low-power laser for neck and back pain, and clearly demonstrated that both patients with both neck or back pain benefited not only immediately but long-term from the treatment with low-power laser. So I think we can make that article, or at least the citation, available to you when you contact the website. And I think that's probably all the questions we will be able to answer today. Any further questions, and some of the other ones which were submitted, you can submit them to the website that I will show you right now. And this is the one to send email any of your questions or concerns. You could send to me at this mymla30.com, or you can phone in any request or message for me at 888-789-0745. And I will usually get these within 24 hours, and I will try to get back to you as my time from my practice permits. Most recently, we've gotten quite busy due to a lot of interest in laser treatments, actually. And so it may take a few days to get an answer from me, but I certainly will answer any questions that you have. Thank you for joining our webinar today, and I hope you will continue to treat pain patients because there's a chronic need to treat these problems. Thank you, and